Hey friends, welcome to Functional Medicine for Moms, where we take root cause approach to fertility, pregnancy, postpartum, and raising healthy families. I'm your host, Dr. Kelly Moline, a pharmacist and functional medicine consultant. Whether you're preparing for pregnancy, trying to conceive, navigating life with a newborn, or simply looking for practical ways to support your health naturally, you're in the right place. Each week, we'll dive into functional medicine, natural solutions, and honest conversations from our own family's journey, plus interviews with experts along the way. Let's get into it. Welcome back to another episode of Functional Medicine for Moms. I'm Dr. Kelly Moline, and I have a chiropractor here today to talk all about ear infections. My toddler, my 15-month-old Danielle, over the past few months especially has had some colds, some teething, and pulling on her ears. So I was a lot more concerned about ear infections for my little one and wanted to make sure I was doing everything in my wheelhouse to make sure she is taken care of without needing to reach for those antibiotics. Today, I have Dr. Erin, and she is a prenatal and pediatric chiropractor with 11 years of experience with two thriving practices, one in Brooklyn, New York, and one in the DFW Metroplex of Texas. For over a decade, Dr. Erin has been walking alongside moms, babies, and families, helping them understand that the body is designed to heal. It just needs the right support. She knows this not just as a doctor, but as a mom herself, currently pregnant with her second child and raising her little one at home. Dr. Erin brings a lived understanding of pregnancy, birth, and early childhood to every conversation she has with her practice members. On today's episode, Dr. Erin is tackling a topic she hears about in her office constantly: ear infections. What's really driving them, why they keep coming back, and what a functional root cause approach can offer families beyond the standard prescription. Welcome, Dr. Erin.
Thank you. I'm so excited to be here.
Yeah, so just for our listeners today, what you can expect. Yes, we're talking about the ear infections and why they happen. Babies and toddlers have a little bit different of ear anatomy. So why is that important and why they're more prone to the ear infections? Common signs and symptoms parents should watch for, how to support prevention in a holistic way, natural ways to support comfort and recovery when they do happen, how chiropractic care may help and what parents should know, and when it's important to seek medical care or additional evaluation. So we have a lot to cover about ear infections. And I was just talking to Dr. Erin how my husband Landon was like, why do you have a chiropractor talking about this? So everyone at the end of this episode is going to realize how much Dr. Erin really knows about this and why chiropractors are a great fit for this topic. So let's start right away. What are ear infections and why do they happen?
Awesome. All right. So ear infections is called otitis media. And what that is it is either a bacterial or viral infection that happens with fluid that builds up within the eustachian tube or the ear canal. Now, babies and toddlers get more ear infections than older children or adults because their eustachian tube is more horizontal. It does not have as much of an angle, so it decreases the amount of drainage that can end up happening. And so this starts to cause a buildup. The other couple of factors that really play a key role in this is feeding. So with the ear infections, it's often that there is a bit of bacteria or fluids that come back up through the mouth and the nose and go up into the ear canal and just sit there. And so within my world, there's a lot of different factors that can start to play a major role in creating an environment that fosters more of that bacterial overgrowth or that fluid being retained in the ears rather than it being able to drain as much as it should. And with ear infections, there's two different types. There's the acute, which is just a single ear infection that may be occurring. And then there's also chronic. And that's the one that most people are more worried about. And when you have a chronic ear infection, that is when you start to have 3 or more within 6 months or 4 within a year. And that's when the pediatrician is going to really start to talk more about doing more interventions. That's the repeat antibiotics. that's really starting to talk about possibly putting in tubes to help support that kiddo. And we really want to help get to the root cause of what's going on with that ear infection rather than just masking it or giving them antibiotics, because we all know that that starts to cause more detriment to the digestive system, to the immune system. And so there are a lot of different ways that we can help support this kiddo through this process to help reduce out the symptoms of the current ear infection and then keep it from continually happening again and again.
Perfect. So you mentioned virus versus bacteria too. Uh, for those listening, antibiotics do not help kill viruses. They only help kill bacteria. So when we have more of a bacterial infection is when we typically want antibiotics. We don't want to use antibiotics in a viral infection. Do we know when looking at our kiddo, one, do they have an ear infection? And two, virus versus bacterial? Because like I purchased an otoscope after my NP friend told me, hey, just look in there, especially when they're teething, because they're going to be pulling on that ear as well. So could you kind of briefly talk about those three and why teething can influence that ear pulling too?
Okay. So there's multiple different factors that happen, and usually it is that kiddo has a lower immune system because they're still building that immune system as an infant and as a toddler. And so if they are exposed to any sort of virus, that starts to set the stage for some inflammation and some fluid to start to build up within the ear canal. That inflammation will again inhibit the ability for that drainage to start to happen, which just sets the stage for more bacteria to be able to accumulate and grow within that area. Bacteria and viruses are natural and they are something that we're dealing with all the time. It's more about that child's ability to function and be able to interact with them appropriately rather than them getting out of control. And so often with teething, what we end up having also is there's more saliva. They're learning how to try to swallow that. And that back pressure can also cause a lot of that to come back up and sit in the fluid of the ears. Often with teething, we're going to be giving them something to chew on. They're going to chew on their hands. So again, it's another time when we're going to be exposed to more of those bacteria and viruses just because of our environment. And the third piece is our nervous system is focused on giving so much of that energy to that teething process of the tooth coming through that it's not going to be giving as much of that energy to the immune system, to the body and its ability to um, be able to fight off the bacteria and viruses and be able to drain the fluid. But from a very biomechanical standpoint, we really need to look at the anatomy of that child, really looking at the base of the skull and the very top bone of the spine. And that's really where chiropractic comes in our approach of going to that root cause of helping the nervous system function at its absolute best and making sure that the nerve innervation from the brain to that area is working optimally at 100%, because that is really where we start to see major shifts and changes happen for that kiddo in terms of the reoccurring ear infections. Would you like me to go into that a little bit?
Yeah, please do.
Awesome. Okay. So often with ear infections, we don't really see it as just the exposure to the bacteria. We have to go all the way back, often when that baby was inside of their mother, because that's when the nervous system is really starting to form. And so that is setting the stage for how that child is going to enter this world and how their nervous system is then going to react to everything going on around them. If that mother is stressed during pregnancy, that cortisol, which is that fight or flight hormone, does pass through the placenta and just primes that baby to be a little bit more reactive or dysregulated. I also call them more sensitive or perceptive to their environment, but just primes them to be a little bit more reactionary when they do enter into this world. Then we have birth. And birth is absolutely beautiful, but it can absolutely cause stress physically to the baby's head and upper cervical spine or upper neck area, especially if there was an induction, if forceps or vacuum was used, if there was a very long labor or a baby was asynclitic, that's when their head is slightly turned trying to go through the birth canal. all of that will put a lot of extra stress and tension at the very top bone in the spine. That bone is called the atlas. And that one is the keystone to the entire spine because it sits right next to the vagus nerve. Now, this is especially important for ear infections because the nerves that exit right out of there go and innervate the cheek, the tongue, and the neck. The nerve that exits out of the atlas goes and innervates the muscle that actually will pull on the eustachian tube to allow it to open and allow the fluid to then drain. That's the important piece is it's actually a muscle that innervates that eustachian tube that helps it open up so that it can drain efficiently. So when there's stress that's placed on that very top bone in the spine that causes it to move out of its correct alignment, it then restricts the ability for that muscle to then move and keeps the fluid then stuck within the ear canal, which then can start to create the environment for that ear infection to then really start to harness. And that's when you start to get those acute ear infections that start to happen. Now, when we go to the pediatrician and get antibiotics for this ear infection, it does help reduce out the bacterial overgrowth if that is present, but it doesn't fix the root cause, which is that the nervous system is not able to communicate from the brain to that muscle to tell the eustachian tube to go down. So instead, we're going to start to have those reoccurring ear infections over and over because it's not actually affecting the root cause of what's going on. The other thing that's really important with that area of the body is it is right where the vagus nerve is. And the vagus nerve is the important nerve that helps regulate the digestive system and the autonomic nervous system. And so if that area has tension and restriction in its communication, we're then going to start to get a buildup. And that's when we start to see immune issues, digestive issues, and then adding on the antibiotics just start to send that kiddo into that spiral. So really our main goal is to help the nervous system create that balance and resiliency so that it can function the way that it's meant to. And just because you had a difficult birth or a really stressful pregnancy doesn't mean this is going to absolutely lead to your child having ear infections, but it's something that we can help support and release out that tension and allow their body to start to optimize so that if these things do come up, their body can start to handle it and release it out, and they don't have to store that tension in their body their entire life.
Okay. So, a few things that I want to ask on things that you covered. One was like the stress on the mom. Like, there's obviously different stressors that can happen throughout pregnancy, but one of them you said was an induction. And I know providers are scheduling a lot of inductions and they're normalized a lot nowadays. So it's just, I don't even want to say like a simple induction because if you've been through an induction, a lot of times they aren't that simple. But even that can increase stress on the baby. Is that correct?
For multiple different reasons. There's different ways of induction, whether you're doing the Foley balloon or Cytotech, breaking the water. All of those are sending that woman into a heightened stress state, and it puts more stress on baby prior to the natural contractions happening. So, for example, like with Pitocin, we're pretty aware that Pitocin just starts to squeeze the uterus and really starts to restrict the gaps, those breaks in between the contractions that are really necessary for that mama to recover. But same thing's going on for baby. So if they're getting squeezed without that break, it's really taxing on their nervous system and on their heart. But then even if their body is in a certain position, it can be causing more compression based on those different compressional forces.
Sure, that makes sense to me. I am one that likes more of the natural, let your body, do what it's meant to do, but I understand that sometimes people need that as well. And so, would you recommend like earlier intervention with chiropractic with the baby and likely the mom, but the baby especially that could help relieve some of that stress right away to have better outcomes later on?
Absolutely. So there's been studies that have shown that 98% of all babies that are born do have that misalignment at that atlas, that bone at the very
Wow.
top of the spine. Yes. So it is very much I'm going to say like a very common, normal happening, but it's really just how does that baby then begin to regulate, and are they able to get it to go back into alignment on their own, or is that just how their body is stuck? And there are earlier signs of that dysregulation due to that misalignment from go. Often we'll see a tight jaw because it sits right at the jaw. So baby won't be able to open up their mouth fully. They can't stick their tongue out. We'll find breastfeeding issues, even bottle feeding issues of just not being efficient feeding from a bottle. And those are usually those early signs that start to tell us that this area of the body is in tension restriction. And then we'll start to see a head preference. And that's usually one of the clearest is because that atlas does control head rotation. And so when that bone does misalign, or what we call subluxate, it rotates, and that just becomes their new set point. It's not that they can't go both ways, but usually there's a decreased range of motion in one direction. And then we'll start to get the flattening on the side of the head also, because the amount of time that they're spending in there. So it is one of those things that it tends to start to spiral into these new symptoms or signs that show up. And I really like changing that lexicon out of symptoms to signs, because the body is talking to us.
Yeah.
And as mamas, our main role, I think, is to be able to listen to our child. And sometimes when they're not able to communicate with us, like sub 2, 3, we have to listen to how their body is talking and communicating to us. And it is nuanced. It is something that is a learned behavior, but that mama bear instinct is spot on. It's really strong. And being able to just listen to that and be like, huh, that's funny. That doesn't look right. Or, huh, there just seems to be something holding them back. And that's really where chiropractic comes in, is we just want to lift off that roof and allow them to thrive, allow them to be their absolute best. And I know that if their brain and body is connected and communicating without any sort of restriction, then the possibilities are endless. They can really grow and be their best selves.
Hey friend, real quick before we get back to today's episode, if you're hoping to conceive within the next year, currently trying to get pregnant, or wondering if there's more you can be doing to support your fertility, I created something specifically for you. My new Preparing for Pregnancy Guide is a comprehensive resource that walks through the foundations of fertility and preconception health from a functional medicine perspective. We cover nutrition, blood sugar balance, sleep, stress and nervous system support, gut health, supplements, ovulation tracking, male fertility, fertility testing, and even considerations for IUI and IVF. I created this guide because so many couples are told to just keep trying and wait, when there are often practical steps you can take right now to support your health and fertility. Whether you've been trying for a few months, are planning ahead, or simply want to feel more prepared before pregnancy, this guide will help you create a clear plan and understand where to focus your efforts. You can find it at molinmethod.com/fertility. And because you're a listener of the podcast, you can use the code podcast25 to save $25 at checkout. All right, let's get back to today's episode. Great. So what I'm hearing is the physical stuff, especially around that jaw and upper spine, when that is fixed in a certain position that may be unnatural or just kind of stress there, where it's kind of stuck, like you have a sore ankle or something like that, then that just puts more stress on the body, and so it can't drain the tubes. And then the excess stress from like the nervous system dysregulation and the vagus nerve, if that has excess stress, that also can't drain the tubes. Is that kind of what we're going for?
Exactly. Yes. So if there's stress at the top, it's going to inhibit the brain's communication to the muscle, the tensor veli palatini, which is not going to allow the eustachian tube to open up to allow the fluid to drain. So that's going to create an environment that's going to allow that bacteria to sit there. And that's when it's going to start to foster that inflammation. And that's when we're going to start to have that ear infection. often that first sign of the kids pulling on their ears is them trying to get their body to release out the tension themselves. And so
Mm,
it is something that is so cool to watch those kiddos start to like touch their ears because that helps move the atlas, that helps start to jostle that area and get it to open up. And so that is something that when a child uh, yawns or swallows or starts to suck, that's part of their anatomy is to allow that eustachian tube to open up. And that's one of the things that does help them start to have that fluid that does drain. But we need to have that proper communication rather than that area just being tight and tense the entire time, because then it's not going to open up at all.
perfect. And then we talked again about the fluid can have viruses or bacteria in them, but that's not necessarily all bad. We don't have to nix every bacteria that we see either with antibiotics. The body can try to figure that out on its own first. So, when do you know when it's gone too far, when you should get more help, or where can a chiropractor maybe be an earlier intervention too?
It's a really great question. So I think that it's great to have more information. And so if the pediatrician is there to be able to use the otoscope, to be able to look, you're going to get more of a baseline of what's going on. And then that allows you as a mama to be able to make those decisions. And I think that you should exhaust all different options in terms of holistic care prior to moving towards antibiotics or going to having the surgery for the tubes. And so I think that every baby should be adjusted. But going to the chiropractor is a really great way to help support their immune system, help regulate their stress and decrease that so that if it is viral, if it is bacterial, or just structural inflammation due to the stress stuck there, that adjustment is going to help with all of that. And so that is a really great first way to help that child not only be able to get through that ear infection, but be able to get through any other uh, exposure that they have because our kids are going to be playing with others. We're going to need to go into daycare. Sometimes they are attached to that pacifier that does increase their rate of ear infections as well. So there are these different things that we can do to help support them. We don't want them living in a bubble. The world is not a bubble. But we can also help support and nourish their nervous system so that if they do have any sort of accident, fall, because that can also cause that trauma at the atlas, um, they can recover and be able to make sure that it is going back into alignment rather than having that stress stuck there.
Yeah, I'm interested how the nervous system has such a big play in ear infections and how like stress on the body can really increase the risk for that because I don't think we think of that. I think we think more of like the structural and the tubes like you're talking about, but how that can really influence each other. I think a big question for parents could be, why are antibiotics bad? Why don't we want to go that route? And in my experience, antibiotics, and my experience as a pharmacist as well. So antibiotics can kill bacteria. It does kill bacteria. It kills the good bacteria and the bad bacteria. So we want it to kill necessarily like the bad bacteria, but it also kills that good bacteria in the gut, which we need for our immune system to process nutrients, to have an overall healthy body. So it's going to wipe out everything. And so if we do have antibiotics, we do want to pair it with probiotics as well. But that is the biggest hesitation, at least I have, with overuse of antibiotics. Especially with kids this little, and if we don't need them, if they can clear it out itself, if we can drain those tubes, I think that that can be very helpful. But do you have any other insight on that?
I'm going to jump back to like the beginning of the conversation, talking
Yeah.
about the antibiotics themselves. So the nervous system is the master control system of the body. It works directly with the digestive system and the immune system so that it can have the proper function. It's called the autonomic nervous system, making sure that our body is doing everything that it needs to stay alive. The nervous system also is kind of like a dimmer switch. When you start to have stress, it starts to fill up and it starts to dim the nervous system's ability to fully process and adapt to new stresses that are coming our way. almost like putting a basket on our shoulders and starting to fill it with lots of water. It's going to start to weigh us down and we're going to slow down. Our feeding or our footing may not be quite as stable as it was before when it was an empty basket, but then our ability to focus on anything else going on around us also diminishes. Same thing's going on in our nervous system is the more taxed it becomes, the less it can give that energy to all of the organ systems and function at 100%. And then it often becomes hyper focused on what's the most critical. Where do I need to send that energy to survive? And then what starts to drop away. And so we first start to see those biomechanical changes start to happen, which alters the movement. And that's when we start to get those first initial signs, whether that is lack of head rotation, whether that's oral function. We're starting to see a diminish in the eustachian's ability to drop down and start to flush. And then over time, it will start to diminish the body's ability to then digest food and be able to assimilate what's coming in. And that's when we start to have changes in the gut microbiome and it starts to take things in as foreign and want to start to invade. So that's going to be allergies start to show up and we start to see autoimmune responses because the body is so taxed that it can't recognize what is good and everything seems foreign and is going to be harmful. When you start to add on the antibiotics, it throws off that gut microbiome even further. So like you said, the antibiotics work. They kill the bacteria, but it doesn't always go to just the bad bacteria. It goes to the good too. And that microbiome is so important for our body to be able to digest food well and then maintain that homeostasis of not looking at everything as a foreigner. Same thing happens in an adult's body. So if you're really stressed out, you get a stomach ache. Often foods that you eat all the time, like you don't digest it as well. We're not having good poops. Like it really does change how our body is functioning. And this happens for kiddos too. It's just they're sponges. They're going to pick up on what's going on in their environment. There's a lot more toxins in the world that we're living in, but they're aware of our mental and emotional stresses too. And so they're just being bathed without a mature nervous system and higher level of thinking to be able to be like, okay, this is not a huge fire that we need to put out. It's just mom and dad having a conversation and it just got a little louder than it needed to be that day. For them, sometimes it just seems like everything may be a larger stressor for their nervous system to not be able to recognize what's going on and they just store it in their body as tension. And like we talked about earlier, it just starts to diminish the nervous system's ability to process, adapt, and have an appropriate output. And that's really where that importance comes in.
Perfect. So what I'm hearing too is ear infections today for our babies or toddlers are, as our tubes kind of get that angling and that correct angling, we likely will see less ear infections as they get older, but you're going to see those allergy symptoms pop up. You're going to see those digestive issues pop up. You can have some of those neurological issues, ADHD, those types of issues come up too, because that's all influenced from the gut as well. Is that correct?
Absolutely. I often say they don't grow out of it, they grow into something else. And so, same thing happens when we take a step backwards. If there's breastfeeding issues, and it's very much from a poor latch, they are not going to breastfeed their whole life. It's easy to switch to the bottle and give them the sustenance that they need, but it doesn't just go away. If the nervous system is stressed, if there is a misalignment or a subluxation at the very top that is not corrected and released out, it's going to start to show up as different symptoms and different parts of the body are then going to be affected. So again, it's going to start very motion and movement because the only things that we need to do to survive are eat, sleep, and poop. So those are the baby's biggest cues to tell us that their nervous system's just not regulating well. It's not communicating optimally, and they may be still growing, which is great. But as a pediatrician, that's what they're looking for. Are they growing? Are they meeting that next step. And there's so much more that we can look at from the nuances to really make sure that they're not just doing okay, but they're thriving. And then that's exactly like you said, they start to grow into those allergies, the asthma, the digestive system issues that then throws off the microbiome. But it's really clear signs that their nervous system is dysregulated and not able to perceive what's going on around them, take that information in, and then have their body have an appropriate or optimal output. And that's really what my goal is to help them have the best output as possible.
Perfect. I think you're giving so much valuable information for our listeners. And right now, I want to kind of create a clear picture of what it may look like for the mom who doesn't want to do nothing, right? And they want to make sure that they have the best for their child. So, first of all, we have birth, however that may look like. You get your baby and likely you to a chiropractor just to reset and make sure that everything is good. Like you said, what did you say? 98% of babies have
98%.
that
Yes.
subluxation in the upper spine. So we can reset that, give them the best opportunity right away. And they may need, regular. I know they're growing so much, especially in that first year, that can be really helpful. But then after that, we're trying to do everything right. We're focusing on whole foods. We're, listening to our mom intuition. And then a cold happens. There's teething at the same time. This is what happened with Danielle. We're getting our molars.
Of course.
And so I'm watching it and, we're still focusing on whole foods. We're probably spending a little less time with our little friends just to make sure we're not getting added exposures. And I have that opportunity and availability because she isn't in daycare right now. So I know that we're blessed with that. But then I'm continuing to watch it. She's nursing more. I did notice that. So that could help drain, it sounds like, naturally. And then I did purchase an otoscope on Amazon, and it does come with a picture of this is what a healthy eardrum looks like. This is when it is infected. So then I did have to pull the ear a little bit down and out just to even out that ear canal so you can see the eardrum. So that can be really helpful. The first time I did it, I said, all I can see is wax and I need help. And so my friend helped me direct into that. And then if you don't feel comfortable with that, you can definitely go to a pediatrician as well. But I felt like I could do that. And then I saw that eardrum and it looked silver, it looked clear. So that looked good. Saw that reflection from the light, basically. And then I scheduled an appointment with a chiropractor so that I felt like I was doing something to help that.
Mhm.
And I knew she was arching a lot and stressed. So that I knew there was like more stress in that system. And then I kind of like watched it from there because even if there is an ear infection, if I saw that in the otoscope, you may still wait 2 to 3 days to see if it clears. Am I
Absolutely.
kind of creating a good picture?
Yes. And I think that as moms, we're meant to be our children's doctors. And more information that we have, the better. And often we just want to know what and why and what we can do to try to help. And so I think that purchasing the otoscope and being able to look in there and see it for yourself gives you a lot more power to understand what's going on and be able to track it before running to the pediatrician, because that's time, that's money, that is, and then they're going to want to give you something to help that because that's often what we're going for, is
Yeah.
like, we need something, please help me. And so in they are good people and they're like there's really
Hmm.
good intentions behind it. And so they'll prescribe the antibiotic because that's their formula. That's just what they do. And often that does help, but it's not going to go to that root cause. And so we need to teach the body how to heal itself, how to be resilient and not rely on these external medications to try to take care of the problem. And so that absolutely, watching for fever, usually with ear infections, we're going to see a low grade fever, but just making sure that it doesn't get high. We can use warm compress on the ear, which will help with a couple different things. It brings fluid to the area. That blood supply will help with the nourishment and the healing of that area. It helps with the pain. And then it can also help with some of the musculature. So similar to like when we have a really big workout and we're sore, a little bit of heat pad on our body feels really nice. Same thing for them. Because those muscles are all within that area, a little bit of a warm compress may really feel nice and help their nervous system start to relax, which will help the eustachian tube be able to drain a little bit better for them too. And then getting
Yeah.
outside, we need vitamin D. We need those probiotics, especially if the antibiotics are being used. And then being able to do a little bit more breastfeeding because that will help with the flushing, but then doing it a little bit more upright. So if you are bottle feeding, get them off of their back, get them in a more reclined position is very helpful for helping that drain. And then trying to reduce the pacifier usage, especially while on their back, because the pacifier has been known to increase the likelihood of ear infections, especially reoccurring ear infections, from 2 to 3 times as much. So, and again, pacifiers are difficult, especially if they're very reliant on it, but that could be a factor that is playing a major role in the ear infections as well.
Sure. So if you have a kiddo that loves a pacifier and you've been considering weaning or getting off of it if they're having those recurrent ear infections, that would be a good sign to do that earlier rather than later. And I liked the point too that you said doctors, they're really trying to help. And when they have someone come to them, and this is why my nurse practitioner friend suggested that I purchase this online. It's because there's so many moms that bring their kiddo in and she looks at their ear and one, it's either fine, which I think is still good to know, or two, like there's an ear infection, but like she said, you can wait a few days and see if it clears. But by that point, you've spent the money on the copay. You've already taken PTO maybe, or used your whole day to come to this urgent care. And then to leave with nothing can be really disheartening. So they are expecting, and they need good reviews too, the doctor's offices. So they're expecting to hand something out so it feels like you made your trip worthwhile. And it's up to the mom if they want to pick up the antibiotic or wait a couple days. But I think a lot of people, they don't want to feel like they're doing nothing. So they want to feel like they're really helping their children. And I was the same way. If my kiddo needs an antibiotic, I'm going to do that. But let me take the steps prior to either help prevent that or to watch it so that we may not need it. And I don't want to overuse that.
Absolutely. And then help prevent it from being a chronic reoccurring infection that ends up happening. Because if we're just wiping away the bacteria and not affecting the physical underlying cause, then they're just going to keep happening. And then that's when our stress goes up because we really want to help them. We don't like seeing them uncomfortable. It's not fun. And then bigger decisions have to start happening if tubes are in the thought process. So it's something that is preventable. And I think that being able to have a chiropractor in your back pocket for those times when teething is happening and the nervous system is overwhelmed, we're going through a sleep regression, all of these are signs that the nervous system just needs a little extra support.
Yeah. And obviously, this is a great episode to hear if you're just entering that teething phase. But if this is your second or third kiddo, or if you've already done that, no worries. We only know what we know. And so we try to do the best with the information we have.
Absolutely. And I do want to touch on that a chiropractic adjustment for an infant and toddler is very different than an adult. It's the amount of pressure you would touch your eyeball with or a ripe peach. So just that light touch is enough for the nervous system to connect to that tension and release it out. And we're just releasing out the stored layers of tension and going to the areas that are working well and allowing that to spread. So there's no popping, cracking, twisting whatsoever. It looks way different to the point where most parents are like, "Did you even do anything? That was it." But it's amazing to watch a baby get adjusted because it does shift their system so quickly, and you can watch it in real time. Their body just melt and really relax. So it's really cool.
Thank you for covering that too, because I know a lot of adults are fearful of chiropractors and that, neck cracking and that type of stuff. And when I first took her, it's your most prized possession. And so
Absolutely.
obviously you don't want anything bad happening. So my Danielle's first chiropractor explained kind of the same thing, that it's very, very light touch and it looks kind of like a little massage more than anything, from what I see. So, yeah, that I think is really helpful. And did you have any last remarks on this topic, ear infections or anything like that?
Don't think so. I think we covered everything.
I think so too. And so I always ask my guests if you're to give any advice to our functional medicine for mom listeners, it can be about this topic or motherhood in general. What advice would you have?
I would have two things to say. First is to absolutely always listen to your gut. If that instinct is telling you something is off, something is wrong, something is not 100% or ideal, you are right, 100%. And keep searching until you find someone that is going to agree with you and listen to you. Because it's very easy to just be told that there's nothing wrong. But if that starts to give you those little yellow warning flags, you need to listen to that. And I really think it's important to empower you to trust that instinct, because you are your child's biggest advocate. You want them to be their absolute best. So I think it's really important to be able to listen to yourself and trust that. And just off of that is if you see something that's funny or looks a little off, or like you giggle, you make a joke about it, it's because it is a little funny or off. And again, it's that mama instinct of telling you that something's just not ideal and not right. And being able to go to the pediatrician or going to a chiropractor, being able to ask them, I saw this, take a video and show them. And if the pediatrician says, oh, they'll grow out of it, or that's normal, ask the chiropractor, because it can be common and happen to a lot of people, but not be normal or ideal. So that's really where
Sure.
we come in, of being able to help make sure that that child thrives rather than just survives.
Optimizing your health.
Yes, exactly.
Perfect. Well, where can they find you, Dr. Erin?
My practice is called Flower of Life Chiropractic. And so that is the best place to reach me at, in both DFW and in Brooklyn. And if you are not in either of those two areas, feel free to still reach out. I am a great resource for being able to find good chiropractors in the area, because they're not all created equal. And that's really important, especially with you during pregnancy and with your little one, really making sure that you do have a chiropractor that is specialized in the nervous system, and working with that special population is something that I'm truly passionate about, making sure that you find the right fit. So I would love to communicate with all of you, and thank you so much for listening.
All right. Thank you, Dr. Erin. Thanks so much for listening to my podcast, Functional Medicine for Moms. If you enjoyed today's episode, make sure to subscribe so you never miss one, leave a quick 5-star review, and share it with your mom friends who love it too. I'm Kelly, with a background as a pharmacist and training in functional medicine. I help women move past fatigue, brain fog, gut issues, and hormone struggles so they can thrive in everyday life or prepare for a healthy pregnancy. Through lab testing, personalized supplements, and functional medicine coaching, I help you feel better, faster, naturally. Want to connect more? Head over to molinmethod.com or come hang out with me on Instagram and YouTube at Functional Medicine for Moms. On my site, you can order professional grade supplements at my discount, or book a free discovery call if you'd like to see how we can work together on your health. This podcast is for educational purposes only and not medical advice. Always talk to your provider before making changes to your health plan. And remember, healthy moms raise healthy families. Catch you next time. New episodes released every Wednesday.